It's the April buyout day, and I am so excited. We're going to be saving lives today. Soon, trailers are going to be pulling up the driveway, and horses will be getting off, and we're going to be giving them everything they need. We have 2 veterinarians standing by to just, treat whatever illness, injury, whatever we can. Sometimes, and this breaks my heart, sometimes the horses that come off the trailer, they're just too far gone. And there's nothing we can do but give them the last act of kindness. But for every horse we give the last act of kindness to, that suffering is over. And that horse can never go to slaughter. But we're not going to focus on the negative. We're going to focus on the positive. And today we are saving so many lives from shipping to slaughter. So come with the journey. Let's see what the team's doing. I know the first trailer is already here doing the paperwork. So let's catch up with the intake team, see how it's going. Watch them get prepared. You can see Dr. Lydia in the background hauling hay around. Everybody's on deck. Everybody's ready to save lives.
I'm trying to send out a email to fundraise because I wasn't able to get it out yet, and it's going to get very, very busy here. So at least I'm not on the side of the road fundraising. I've done that before, sitting on the side of the road with my computer. But
how many horses are already here? Do you know?
There's 20 that have come in from yesterday and that are in the trailer right now to be unloaded, and there's more coming in. And we'll also have a trailer trying to intercept horses from being taken to the auction as well. So that's a couple hours away from here. So
a very, very busy day.
Very busy day.
And it's just starting.
It actually started yesterday because we had 5 come in. And there's one of them that's completely blind. He's down in the vet barn. I believe there's 2 over there. And then there were some others that I know had organ failure. At least one. From the 5 horses from yesterday, you want to give a little update on those 5?
Sure, absolutely.
Since you don't have anything else to do.
Yeah.
The paint mare, unfortunately, we ran a CBC chemistry on, and she has kidney disease, liver disease, icterus, really high white cell count. So she's got an infection and kidney and liver compromise. So to treat the infection, we need to do systemic antibiotics and anti-inflammatories, and those drugs are really hard on the liver and kidneys. She's also clinically dehydrated and has a full skin thickness wound over her eye, so she needs surgery to treat that. We managed her yesterday just with topical wound ointment and some anti-inflammatories, but unfortunately, I think her prognosis is very poor. Anything we would do to treat one problem would make another problem worse. So unfortunately, I think we're going to recommend last act of kindness for that mare. The 19-year-old bay gelding with bilateral blindness, his eyes are both really painful. So we want to do his enucleations as soon as we can, but unfortunately he also has an infection. So we gave him antibiotics yesterday. He's got some pretty severe swelling and drainage in his face, and his platelet count was only 15, so he wasn't a good surgical candidate yesterday. We need our platelets to clot. He is in our medical hospital. We're treating him with systemic anti-inflammatories and also eye drops. And his favorite flavor of treat is butterscotch. He doesn't like the peppermint ones.
And not to cut you short, but the trailer is here.
He's doing well.
So.
All of the other horses we saw yesterday are stable and on the list for further diagnostics.
All right, thank you, Dr. Lydia.
Hey guys.
And the trailer is here. Horse number 1. Number 2. Again, this is the almost live auction. This is the almost live buyout intake. These horses, this is the first time we've seen these horses coming off the trailer.
Can we pull that horse?
This horse has a very painful right hind leg. Hard to use it. Poor thing. This one's got a rope on.
Easy, buddy.
This one is. Spray it, Tony.
So Corey is spraying the horses with spray paint so we know which trailer they came off of, or which group they came with. That helps for disease control and identification purposes. And this horse cannot put weight on his back right leg. Poor horse. And this horse has got a freeze brand.
Yeah, that horse is blind.
And it's blind. And then 2 studs, I think you said?
One stud.
1 stud.
This guy blind too. Here, pal. Down.
Poor blind horses, they're in a whole new environment. They don't know where to go. They can hear me. It's okay. Got some panels right here. And this horse, you can tell it's got some bad front hooves. So this horse is blind. Easy, buddy. Easy. Easy. I know, it's scary. Easy, guys. And it's always so sad when blind horses are in an all new environment. They just don't know what to do. And I'm gonna jump on in here. A little bit of a higher view for you. And this draft horse is humongous, but look at those feet. Oh, such bad feet. This one, this is also a draft horse. Doesn't seem to have as bad of feet. So we're hoping that at least some of the draft horses are doing okay. And here Tawny's working with the black one that had really painful back right leg. Kind of an overview of the chaos. And it's pretty wild. Yeah, this is not the one with the really bad feet, but they're still a little bit, not as good as they could be. But look at that sweet face. All right, I'm gonna change angles.
So stifle is very hot. Looks like we may be looking at femur. But lower down in the leg is also swollen. Okay. So this poor guy came off the trailer. Tanya and I snagged him immediately. He had pain and anti-inflammatory medications administered intravenously at a pretty high dose within 30 seconds. His intake heart rate was 88. So heart rate is one of our best indicators of pain. If you look at this horse's musculature, he's got severe atrophy on the right hind and hypertrophy on the left hind. So he's been compensating, and he's got his left hind leg turned in and tucked underneath. He's been compensating. That degree of atrophy and hypertrophy takes time. So this horse probably injured this leg at least months ago. So what we want to do with him is do some diagnostics so that we can give him the best chance of survival. If he has a femoral fracture or a hip fracture, that's unfortunately not survivable, but an abscess sometimes can manifest as non-weight bearing lameness. So we would never want to euthanize a horse that has a condition that we could treat. So because we have 19 other horses that just showed up, we want to make sure that every horse that arrives gets appropriate triage. We're going to let this guy have a drink, have some hay, let those pain medications kick in, and his response to those pain medications will help our vet team determine what his prognosis is. He does seem to be compensating well, but obviously if he's got a unstable fracture, we're not going to let him hang out here for forever. But this gives us a few minutes to make evidence-based decisions. That's our job as clinicians, is always using those evidence. Sometimes we don't need a radiograph. If we have a bone sticking out of a leg or a severe angle change, we can make that definitive diagnosis without a diagnostic, but we have radiographs here. So anytime we can possibly see if they have a chance, we want to see if they have that chance.
Last month there was some concerns that we had a very critical horse. So you're fine. Stay here. Stay here.
Oh, stay here. Okay.
Yeah. Last month we had a very critical horse come off the trailer, non-weight bearing on one leg, and I said he's very critical. He's a priority. And some of our viewers didn't realize, we put him in a stall just like we did him, and they're like, if he's in pain, why are you just leaving him there?
Yeah,
and
he had pain meds.
He
right
had
away.
pain meds right away. So
I'm just sneaky with the pain meds, and I don't always stop and make sure it's on film because that's not. I know, but
pause and explain everything, but the reason sometimes like we put them in here is sometimes it's the first time in their last year or 2 years that they're actually pain-free from the pain medicine. So bringing a horse in that's extremely critical into the stall with pain meds, water and food is kind of the first time they're able to find peace. So we're not putting critical horses in here and walking away and they're suffering.
Yeah.
They're under vet care with drugs to make them comfortable.
Yeah. Heart rate of 28 means we've got a little bit of time to work with, but I agree. Does she have digital pulses?
I haven't touched her yet.
Okay.
And it looks like she has an abscess on her right
hip.
there too.
This poor little pain.
This mare, Dr. Gina?
Spinning like she has a typical founder stance. Her heart rate is 28 and it's muffled. But she's obviously painful. And so we're giving her some Banamine and we're gonna do some further diagnostics.
I don't know about you, but I think it's absolutely fabulous and amazing that we have two highly qualified veterinarians here working with these horses simultaneously. The most critical ones are seen right off the bat. It's a dream come true for Buyout Intake to have two veterinarians working with these horses at the same time, because they can treat twice as many horses twice as fast, and horses can get the pain relief that they need. And I think it's great. So back to the intake.
Let me take a listen to his lungs.
I'll be fine.
So this is
I'm just being a pansy.
this horse has a tracheostomy in place, but it's so infected that it's sealed over, and he is breathing through his nostrils, which is a great sign for him. He does have some elevated lung sounds.
That's wild. I've never seen that on a horse myself.
Never seen one in place before.
And then his hooves are disaster, just disaster. Every bit of disaster you can imagine on a hoof. Those guys. Is this a boy's roller neck?
Get the mare.
Anyone check you?
Like pus is like going down in his throat because
What I want to know is, how would you go through putting a surgical tracheostomy in place and not do anything about these feet?
Do you think maybe it's a layperson just kind of doing
No
it?
layperson can put a trach in.
Okay.
No, that's... I mean, the jugular and the carotid run right there, so...
So a medical professional put it in and ignored everything else.
Well,
I mean,
not to criticize that person, as a clinician,
This horse
we can...
back here, just so you guys know, is biting on the other one.
Hi, no
just
biting.
So you know.
Oh my goodness.
Hi, friend.
So really focus on this underneath here too. That is, it's gnarly.
So Corey, this horse has a normal heart rate and a normal respiratory rate. He does have elevated lung sounds, but he is breathing out of both nostrils.
Yeah.
So
look at
I'd
that
like to
poor
pull blood for a
leg.
CBC chem on him and get foot rads, but I think he is stable for now.
Um,
I just need his other side. We need rads on this horse too.
Do you have conjunctivitis? Or are you just really dehydrated?
What is this like when horses come off the trailer for you?
I'm an optimist, but I really have to guard my heart on intake days because there's a lot of long-term suffering that's really hard to see.
To think of how long they've gone through this
it's
before
hard.
they came here. It's like,
I love it when we can save them, and I always want to save every single one. I think the first hour is the hardest because, you know, some of them that look okay, you listen to them and they're like in cardiac arrest or, you know, like in horrible shape, and you don't know it from looking at them. So I have a love-hate relationship with intake days.
I'm gonna turn this horse around. Just watch your back.
Okay, I'm gonna say that everybody here, I'm okay with waiting for a few minutes. So we
I'm
can
ready on the
regular
horse eating
stuff.
the leaves.
I would like blood for whether it's just
the first part of
anatomical, but it
intake
looks like
is
he's got
really
recessed eyes on both
like
sides, so I don't know if he's
triage. And we're making really hard decisions, and it's really hard because these are beautiful animals. And like Dr. Lydia said, they've been suffering for a long time. And when you think about how long some of these horses, I mean, we can tell like from their hooves and growth of injuries and whatnot, like it could be years that they've been suffering. And to be doing a triage and jumping in and figuring out who needs last act of kindness the most is really hard. And then, you know, with the horse with the tracheotomy tube, like who who left that in? Who put it in there to begin with? But then who just left it in there? And like, all of these horses are prime candidates for going to slaughter. And because of the buyout program, we're able to intercept them, and that is so critical and so important. But we can't do it alone. We need your support. This is one of our barn cats. He helps with mice, and he's trying to be a supervisor on intake.
And he seems to be doing fine, but he's just cruising around.
I'm gonna try to find a safer spot for him, but sometimes we can't keep him out of these areas.
Hey, Jason. You got any water in your back of your truck?
Maybe one bottle?
Maybe one bottle?
Yeah, like the
Okay.
amount of gunk that's just in there.
So
We need
last
water
time we
bottles.
got this many draft horses in one rescue effort. I think it was over a year ago. I think we got 8 to 12 maybe in that one rescue that we did out in Cookville. So Dr. Lydia's already looked at them all. She thinks that prognosis is good on most of them. We just got to clear up some infections and take care of some feet. But I'm pretty happy with this so far.
Awesome. I'll go look for water. So what are we doing with this horse?
We are going to get some radiographs on her feet. It looks like she's foundered, and Dr. Lydia also thinks she may have ring bone, but this horse is in a lot of pain, and it's very heartbreaking.
Every person around the x-ray gets lead protector on, and human safety is of utmost importance. And we've got a whole bunch of lead protective suits. Looks like Dr. Gina's going to be the x-rayer. This is one of the blind horses coming and getting its intake done. Initial assessment.
Can I get the microchip sticker, please? You don't have one?
I mean, there's the crusty one over here.
Crusty.
I know your friend is right here.
Apparently we have to use the crusty scanner today. Hopefully the crusty one works well.
Got some wither pain. No, hi.
Alright, get the x-ray done.
Looks like some severe rotation, and there's also been some lysis of the bone, the coffin bone.
Yeah, Dr. Gina was diagnosed as has severe rotation
Are we gonna?
and some dissolving of the bone.
That's probably not.
I mean, if she'll let us, we can do it.
Sad.
Yeah, she's having a hard time picking that one up.
Very
Part.
sad.
No,
But that's
her
why we're
best.
here, is to save horses like this.
Try it though.
I'm having to make the very long, strenuous journey down to Mexico.
Right.
And if we can stop her, at least we prevented all that suffering.
Alright, so this really pretty paint mare, we were suspecting she had founder, and the radiographs confirmed that she has severe rotation greater than 45 degrees in the 1 foot that she would let us take radiographs of. So unfortunately, this advanced stage of it, there's nothing we can do to really manage her pain long term. So for quality of life purposes, we think the last act of kindness is the best thing for her. Sorry,
It's just
sweetie.
really sad. Over 45 degrees rotation, and just incredibly sad.
I am fundraising on my phone and on the computer. Buyout rescue missions take a lot of money. Trailer loads come up. I mean, it's thousands of dollars to purchase these horses and intercept them from being taken to the auction or, I mean, direct ship to slaughter. And I have to fundraise. And unfortunately, there just aren't enough hours in the day for me to get everything done and try to have a work-life balance. So I am here fundraising, trying to get more donations because we are being asked, hey, can you take these 7 horses or should I take them to the auction? And it's very much a fast action. Is the money going to be there to save them or will it not be? And that's a lot of stress on a fundraiser to get as much donations in so we can save as many horses as possible. So I'm working on
and a lot
that.
of time we have to step out and save it.
And yeah, sometimes it's like we hope the donations come in, but when horses come in and they're here, it's like, oh, they're safe, they don't need donations. But no, we're stepping out in faith, hoping that you all will cover the cost of their rescue and care. So it's a lot.
Pictures. Can we bring him over here? Sure. When it's backlit, like I can't see. Hi, friend. Can you take a picture from the other side? Can you get this side? I can, but I'll need to, we'll have to turn him one way or the other to get. Sweet boy, we think is a standard-bred gelding. He is fully blind, but otherwise we don't have any health concerns about him. His feet are extremely long. And he's got some bony abnormalities, but he's not visibly lame. So he got his vaccines and his microchip and some oral medications, and we're gonna turn him out and do those more advanced diagnostics at another time because he's stable. He's a very good boy. He's a very well-adjusted blind horse. I think he's probably been blind for a long time. Your heart murmur. And looks to be, that incisor is just completely missing. I know. I know, Mama. Can I see? So Galvani's groove is completely absent, so she's at least 30. She has a very severe heart murmur. You're a good boy.
Look how skinny this poor horse is. So Dr. Lydia said that this horse has a very severe heart murmur and she's about 30 or even older. And you'll see how poor of condition this horse
Missing
is.
some incisors. You'll have to look. Hi, are you
It's sad.
baby?
But she's not going to slaughter. Hey, you got it, Kimberly.
What?
You got it. Numbers are hard when they're going so fast.
It's great. I love it.
So this is number 137 that's come through our shelter this year. Is that how that works?
130, it's number 137 of buyout. Yeah. So
Okay.
like that doesn't count like owner
Gotcha.
surrenders and stuff like that.
Gotcha. And I mean, this is just the start of the day. So
But yeah.
we're going to hit like 150 plus today for
Yeah.
sure.
Yeah.
Cool. So this horse is completely blind and not as well adjusted, I would say, as the standard bred that went through before. But
Got a brand on his.
it's a very, very cute horse.
Wait, what?
Can I do this first? What? Oh, the gate? I got the gate.
I mean, I think she was.
This poor horse.
Oh, she's pushing. You have brakes,
I'm
man?
gonna try to look at her teeth. I know.
So this is one that's about 30 years old
Oh, she
and
just
has a
doesn't have.
severe heart murmur.
She doesn't have teeth. So horses are brachydonts, which means their teeth are continuously growing, but at some point the rate of growth and the rate of wear become out of sync. So this mare has, her teeth are worn past the level of the gums on her upper right, and then on her upper left she has some really sharp points.
This horse behind me, the old draft horse, it's quite pushy and it's kind of humorous watching Kimberly try to manhandle this horse who, weighs 10 times as much as she does. And anyway, not the best trained horse. Draft horses, if they get a little bit of an attitude, they'll be like, I can go wherever I want because I'm bigger than you. So anyway, we're having a good time here at the intake. A lot of sad cases though, a lot of good going on though. So yeah, let's get back to it. So the blind horse is coming out of the chute area and it's a little bit hard because she doesn't know she has to put her head down. And it's a little rough. Right now we got some wind coming through, so I probably got some wind noise in the microphone, but
She's super mad about me microchipping her.
horse, yay! Come on out, buddy. No, don't. Wrong way.
Oh, okay.
He's getting something.
You step down.
Someone wants to tap her on the backside. I'll probably.
I just want to run Caitlin over. All right, sweetie, I'm coming up behind you. I'll run Caitlin over.
Come on, it's okay. Come on, baby. Come on, baby. There you go. There you go. It's so hard when a horse is completely blind.
I'm gonna give him some girls stand because.
Come on, baby. Okay. So she's got shoes on, so probably trained to ride. I'll shave down the brand, find out who she is.
These clippers are terrible.
That's weird. It didn't even affect the skin there. 1G maybe?
Yeah. So
1GA?
they just turned off.
1GA something. This horse is getting sedated so that we can get some x-rays and
Good job.
make him more comfortable.
My distracting. Which way?
Thank you, perfect.
That's why.
A lot of people cramming into the stall here. But we're gonna,
Yeah, this horse is painful enough that we want to move him as little as possible. So we're gonna try to take his radiographs in the stall, which is another reason why we sedated him. Can't get radiographically, so we're ruling out lower down structures. I'm not surprised that we haven't seen a fracture yet, just with the way he's moving.
all right, Dr. Lydia said that she's suspecting a fracture, but she's ruling out everything down lower.
Are you doing a live? Okay.
Almost live. We're doing it almost live. In other words, I'm videoing it. I'm gonna put it together and release it this evening.
That's like just
I'm
a
not gonna
regular
try to
edited
move
video.
him.
No.
I'm gonna have to touch
Regular
him,
edited
Kimberly.
video
Oh,
takes,
Heads
takes
up.
hours
Yeah.
and hours. Yeah.
Ready, Bubs?
I see what you're saying.
Raw. It's more raw.
Minimally edited.
Yes. Minimal edit.
Yeah. Like the kind to be mean.
Yeah.
Let's see if we got anything.
You have to hold it still while it's feeding.
Ready?
Swishy.
Okay, you can pull out. This is our femur, and you can see right here, this part of the bone should be smooth. And we've got a fracture line running right up here. So this is consistent with an avulsion fracture where a soft tissue structure pulls a piece off the bone. We weren't able to get higher up. We may have a worse fracture higher up, but we're tucked up underneath his inguinal area as close as our plate can go safely. But we do have evidence of a catastrophic fracture, probably also with a severe soft tissue component. Unfortunately, in shelter medicine, if this were an owned animal, we would probably sedate him really, really heavily to get a better idea. But the outcome would be the same if you have a fractured leg. So this poor boy, I do want to recheck his heart rate. He does seem a lot more comfortable with abandonment on board. We just finished taking radiographs on this sweet boy. We did have to sedate him a little bit. And I suspect he may have a more severe fracture higher up in his leg, but what we found was that he's got some swelling and some abnormalities associated with the stifle joint, and the two bones aligned, the two major bones aligned in this joint are separated from one another and not lined up correctly. So we know that that's abnormal. That indicates a soft tissue injury. We also see evidence of an avulsion fracture, kind of right here. The tendons and ligaments can get ripped so severely that they pull a piece of bone off. This one is pretty severe. It looks like it's about 1 centimeter in. Based on just that, that would be catastrophic enough of a fracture. But the way this horse dangles his leg and has it flop medially makes me concerned that we have a full soft tissue tear. So we're not just dealing with a fracture, we're dealing with a catastrophic soft tissue injury of this leg. And even with Banamine and sedation on board, he still is just barely toe touching. So he's not bearing any weight on this leg, even with good drugs on board. So unfortunately for this guy, I think based on the bony remodeling and the degree of atrophy of this limb and hypertrophy of this limb, looks like it was going on for at least 6 weeks, maybe longer, which is just really heartbreaking for this guy. His heart rate was in the upper 80s when he came in, so he was very, very painful. Thankfully, he did respond well to those pain medications, but he's been painful for at least a month and a half, if not longer. So really unacceptable. Poor buddy. Oh my goodness.
So this is the next horse we're going to be doing the intake on. Hey, buddy.
Sure does.
You're like, hello, camera. I want to be a movie star. Look at these poor feet. That is just unacceptable, unbelievable, and just absolutely terrible. Like, those feet are just, ugh. Ugh.
I need Jason to read my fundraising email. I'm just about ready to send out. So I'm going to take the camera and I'll be videoing while Jason does that.
All right, they're working on that one.
All right, so this poor horse, he is so skinny. He's all sunken in there. Oh, just look at how skinny he is. And his feet are just terrible.
Sorry. Okay, and then just turn back down.
Kimberly is getting photos. We take photos of every single horse. That way we can put them on our Facebook page and show you all his
I'm gonna
feet.
stay away from this.
Yeah, he is very uncomfortable. We're able to document their conditions and Jason, you probably don't want to be there.
I have to be somewhere it's
Well, don't be right there.
He does, yeah. Like Regina noted that. Sorry. Yes. And his feet.
You can see his feet are so bad. And that's a lot of growth. He's not had hoof care.
Did
in a
you
very
see
long time.
underneath all of his growths?
Does he have cancer?
Well, I can't confirm that it's neoplastic, but he does appear to have a lot of
He has been kind of kicky-ish, so just be careful.
tumors underneath his inguinal region. We always worry about squamous cell carcinoma in these light-colored guys, and also melanoma. And those can present externally or internally. Can we get foot rads?
Yes.
Yes. There is an orange spray paint on him. It just tells us where he's come from.
No, he's just pushing.
So which trailer he's come from? Because we have multiple trailers.
Can we get some Banamine?
Sure. How much do you
So
want?
He should have an elevated heart rate, and that's why she's asking
8?
for Banamine.
8 sounds great.
I'm like, it's usually between.
It's pretty sad.
Hey, buddy, you're so beautiful.
I would call him like a,
So she's listening to his lungs.
or like her mellow, because his eyes are like.
He's got elevated lung sounds.
So elevated lung. What did you find out?
His heart rate is a little elevated. It's in the upper 50s. So this is a stressful environment. The horses did get off a trailer, but it's been long enough that I would expect heart rate would return to normal. And his is still elevated enough that I'm concerned that he does have some pain somewhere. We're going to go ahead and give him some pain and anti-inflammatory medication. He is shedding, which is great. Truly, hirsituate horses don't, you want me to give it? Sure. Don't shed if they have a metabolic disorder, but I am most worried about a cancerous process with this horse with all of those tumors. And he does have elevated lung sounds. So normal horse lungs, you basically don't hear anything. And in this horse, you can hear breathing sounds both coming in and going out. You're a good boy.
Which foot do you want first?
I haven't actually palpated feet. Okay. So I don't have a strong. Where are you bleeding from? Is he bleeding? He is bleeding.
There's a blood drop, but I don't know.
Could it be from somebody else?
Maybe.
He was kicking everybody.
There is a drop of blood in front too, right there.
Could be his penis.
That's the Coggins, but I didn't want to pull it and hold them at the same time.
Oh, okay.
'cause I
So
don't
we
really
haven't done
trust
it yet?
him. No.
Yeah, he has.
I don't trust him.
He has blood on his penis itself.
Okay. So he is dripping blood.
Yeah.
That's not good.
Okay. You okay with me poking him?
Ready when you are.
I'll wait till you're not ready.
Got it pre-fed. Added a little bit. Got it all good to go. So
I'm gonna go
yeah.
get it
Any
sent
mistakes?
out.
Now it's my fault.
Well, let's hope. I just hope this email, when it goes out, will help encourage people to donate. And if you're not on our email list, join. You can go to our website and you can join our email list. If you can't figure it out, just send us a message. We'll be happy to add you to our email list.
And is it too late to donate when they watch this video?
No, because we need donations. When you're watching this video, we're going to, because it's going to be released, well, this one will be released earlier, but we're already planning the next buyout day. And if there are more donations coming in, we know that yes, we can say yes to these horses. And that's very important. So donations coming in equals horses getting help. And that's very important. That's our goal and our mission, is to intercept as many horses out of the slaughter pipeline as we can. So I'm gonna go get this email sent out.
Well, and this video is almost live, meaning I'm shooting it, videoing it today, shooting the footage today, and I'm going to be editing it this evening and releasing it this evening. Everything goes well. So, yeah, what these horses are, you're going to be watching this just a few hours after this is taken. So
it looks like we are probably 26 to 28. Galvani's groove is almost all the way back down to the bottom.
This horse is 26 to 28, Dr. Lydia says. I just really want to emphasize how bad these hooves are. Like, it just takes a little bit of work to trim hooves.
Okay.
Look how bad they are.
I have no
This
strong
wrong.
preference. Okay. Can you put your foot down? Does it hurt too much? There we go. Good boy. Good
Alrighty, get some
boy.
x-rays. It'll be very interesting to see what these show.
Perfect. Just go for it. Yeah.
Boy, those hooves, everything seems so messed up.
Beautiful. So we don't want to compare rotation to the hooves the way they are. So normal hoof wall should be about here. And we do have some rotation. So we want these angles to be parallel, and they're not parallel, but we also have a slipper. So this horse is actively foundered. So I have some arthritis up here. Let's go ahead and try to take the other
want the
foot.
other side?
Look how thin that sole is. And look, this is a gas tract. So could just be
Get the side of your way.
part of the frog, but
There we go.
gas is black, so this horse has a tract like a millimeter from the coffin bone. He also has severe rotation and evidence of chronic founder. He's not actively foundering today, which is wonderful, but I think he's probably foundered many, many times over the years, and those feet are just severe. He's got like this much space between his coffin bone and the outside on the left front foot. So unfortunately, at his age and with the severity of his comorbidities, I'm going to recommend last act of kindness for him. I would like to run some blood work so we can learn more, but his feet are going to become more and more of a problem. And his body condition score is also severely underweight. He's missing some teeth as well. And he has the most beautiful eyeballs I've ever seen.
Well, what's going on?
He's not much shorter
Is he
than I
too big?
am. He might be too big to get through here.
That very well is very
Wouldn't be the first time, would it?
Nope, sure wouldn't. Yeah, he's like the same height as me as the withers, so we're not gonna bring him through there. These other two behind him, he might be able to fit through there, but not him.
So he's literally too tall out his withers to fit into our chute system. Well, how heavy did you say this horse was?
1,350 pounds.
That's a big horse.
It's a big horse.
This is exactly the kind of horse they want to ship to slaughter because he's up to weight basically, and almost 1,400 pounds.
I bet if this horse was at a healthy weight, it'd be around 1,500 pounds.
Yeah,
So,
or even more. So
Jason, one thing I want to point out is we paid $500 for
Yes.
him.
so we paid $500.
And if you do the percentage per pound, like if we were at auction bidding against kill buyers, we wouldn't be able to rescue him. It would go above, like we would run out of funds. So the buyout program is amazing. I've almost got the email done.
Well, he has CPL, which with aggressive daily bandage changes, 20% chance that we could fix him.
Absolutely
But
gorgeous
it would
boy.
have to be
41.
You're gonna place this.
We handed him 141.
This blood tube, I'll place it right here.
Hi, I know you're so thin.
Like Lydia's gonna be listening.
I
to
mean,
some
I would say he
hearts
has a
and
sock on
lungs.
the left fine,
Okay.
at least. The rest are just kind of blonde points.
So this is a female?
Yes, this is the mare.
I'm sorry, I called you a he.
I did too, so she's gonna be feeling like we don't
be
know what
too
we're talking
offended.
about.
This might be that she's moving a whole lot, but I don't hear any murmur.
He said he
No heart murmur, yay!
I don't know if you
You're doing good, girl.
Huggins, doop doop.
I gave her 6 probiotics cookies.
Okay.
Yeah.
You're cute.
So what are you thinking?
Said she may have an arrhythmia or it might just be that she was moving too much. So far, she's okay.
Are close to 30.
Oh,
Oh, look on the other side. You're fine. I'll walk around you.
it's Grandma.
Ah, you cute. You're cute girl.
But she looks good.
So I say for a 30-year-old, she's looking real good.
Well, I don't quote me on it until I take a really
Okay.
good look at her teeth. I'm gonna amend that to like 28
Can you take the others back to the
based on this side.
Well, she looks good for a 28-year-old.
She really does. She looks great for a 28-year-old. Let's do all the things with her, and let's put her
You
down
get
for a dental.
everything. You're doing good. Yay. What all, when you say they get everything, what do they get?
She is getting a microchip, a 5-way vaccine, which is Eastern, Western, West Nile, and tetanus. And the Eastern, Western are equine encephalitis. And then she's going to get a rabies vaccine, some electrolytes, some probiotics, and some dewormer.
So they get a lot, but it keeps them healthy.
That's right.
It's the best protocol we found to keep horses. They're coming in from, who knows where, as healthy as we can. Alrighty, this is the next horse Dr. Lydia is looking at. Looks like a boy from here. Love the color. Gorgeous horse.
Happy boy.
You want some treats?
Got some hay. Hay and cookies. All kind of good stuff. Y'all ever seen that happen above a horse's eye when they're chewing? It's kind of fascinating.
Oh, no, doesn't like him.
All right, and Kimberly's getting all the intake photos. Corey's trying to hold the horse.
Other way.
What's amazing is they tell us that draft horses are nice and calm.
Yeah.
That's what they say. And
They
some of
also
them
know
are.
how big they are.
And exactly, they know how big they are. And if they want to go somewhere, they get to go there. Alrighty, good luck.
You're a good boy. I'll walk right behind you, okay? No? Okay.
Oh. That's kind of interesting.
Won't
Find a
right,
boo-boo.
I won't walk behind him. Yeah, that is his bad leg. Okay. Both of them look abnormal.
Still got some hay.
Some pain in his.
This one should be 142.
I'm gonna come over here. Do you feel comfortable turning him and just walking him over there and back?
It's a really long distance, but I think I got
Okay.
it.
Look how he pushes that left leg in.
Need more?
No, that's good.
Okay.
You can stop right there. I don't want to get kicked doing this, but you gonna be mad about this, buddy?
You want him in a bigger space? You want him out
I
here?
want to try to do proprioceptive placing. Yeah, I think in order to better evaluate lameness, we need to move him more. His heart rate is normal, so I don't think he's painful. If it's okay bringing him out. I wasn't trying to disrupt the flow of things.
No, you're fine.
I got my email sent out and excited about that, and also post on Facebook. As horses come in, I will continue to tell the story and fundraise, so hopefully we can save more. Like I said earlier, we're getting phone calls and messages like, hey, can you take these horses or should I take them to the auction? And our goal is to intercept as many as possible and say yes to every horse that we're asked to take, but we need your help to make that happen. And so I was just commenting to Jason as far as like there's a lot of standardbreds in this load, and this load's coming down from Pennsylvania. And Jason's like, and they stopped their journey here. And you know, these are horses that are owned, basically picked up by traders to take them on their path to slaughter, and we're able to intercept them from heading to another auction and pull them out and save them. And that's what it's all about.
I palpate an area of elevated heat, and you can see that lighter yellow spot right there is consistent with the bump that I'm feeling where he is sensitive on that. This is our thermal imaging camera.
So we actually have a thermal imaging camera.
Photos with that, and we can upload it into his
Okay.
Yeah.
Awesome.
Yeah, we actually have a thermal imaging camera. It shows where there's heat and cool, and it's pretty nifty. So Dr. Lydia is testing for neurological problems,
Gotta get his whole tail.
and somebody doing a test where you pull the horse with the tail, and she's watching for a toe drag.
Oh, he doesn't even want to use that leg.
Okay, that was just not normal. Usually the the horse in this case, would just step with the tail. So, very interesting.
They'll call it delayed, but not on the right hind. So he doesn't really-
And it's not hurting the horse. The horse's tail is very, very strong, and it doesn't hurt at all. But it's a really good test to determine how their back legs are working. What did your fancy test tell you?
His proprioceptive placing is abnormal in both left and right hind legs, but in different ways. In the right hind, he eventually recognized and placed the leg correctly, but it was delayed. And in the left hind, he wouldn't place it at all. He just held it up. So he's showing us that he has pain localized to his left hind leg. I suspect that it's actually in his pelvis. Sometimes these guys with a history of pulling have cart accidents. I don't know. But he does have pain on palpation of his pelvis and upper limb on the left hind. He also has back pain. But he also has evidence of a neurologic deficit in the hind limb as well. So both musculoskeletal as well as nervous system seem to be affected.
And does it hurt a horse to pull on the tail? Sorry. I know
No,
you're
it
busy.
doesn't. That proprioceptive placing test, I would never do in a horse that I thought had like an active fracture or something like this. But in this guy, he seems to be stable, and their tails are not innervated in the way that you would think. So that test that I just did didn't cause him any discomfort in any way.
All right, I'll stop asking. So
Sometimes horses don't like it when you hold their tail. And this guy did not like that I palpated his leg, so I was being extra cautious because, we don't want to get kicked. But no, that did not cause him pain. Yeah, you're a good boy. You're being a good boy. All right. So we just finished evaluating this standard-bred gelding. He's about 20 years old, and he has pretty significant left pelvic lameness and pain. Both on movement and palpation. He also has pain on palpation of his spine from about his withers to the level of the pelvis. We can't get great diagnostic radiographs of the equine pelvis because the technology and the quality of the images is related to the size of the structure that you're imaging. But even so, I suspect that what he has going on might be an old fracture of the pelvis or a soft tissue injury of the pelvis. He's very reactive to you working around his hind end, and even standing at rest, he kind of keeps jerking his leg up and placing it abnormally. And I suspect this has been going on for a really long time. If you look at his foot, his leg angles out and turns in, and his hoof growth has grown from a lateral to medial direction. So Wolff's Law has to do with bony changes, but a similar thing happens with the hoof in that it remodels in response to the stresses that are placed on it. So this horse has been abnormal long enough that his whole hoof from the cornet band to the toe has grown out in an abnormal manner to compensate for that hind limb lameness. I wish we could get a radiograph of the pelvis to document that, but he is not comfortable, and I don't think there's anything that our vet team can do to get him comfortable and keep him comfortable. So I'm recommending the last active kindness.
This is a stud trap horse with a horrible, horrible leg.
Poor guy.
Oh, that's just horrible.
It smells terrible.
Connie says
All
it
right,
smells
Corey,
terrible.
I'm gonna try to pull blood.
We're gonna just do it in
No?
the shoe.
We tried in the stall and he was jumping up.
Yeah,
As soon as we poked him, he was.
Okay.
Yeah.
Oh, you can smell it so far away.
Just look at that. That is so bad. He doesn't have a good leg to stand on in the back. You had another horse that's bigger than you, Corey.
Well, he's standing up on a chute right now, so he looks bigger than me. He's got some really bad infection going on in his hind legs, though. I don't know if it's appropriate to show him live or not. It's pretty bad.
Well, this is not live, but
Oh, okay. But
yeah,
it's pretty
almost
bad.
live. Maybe.
One of them is actually bleeding right now. It's kind of busted open, but both of his fetlocks are about the size of basketballs, and it smells awful. As soon as he got off the trailer, we were able to smell it. He's been in the stall over there, and we were able to smell it on the other side of the building. It's so bad.
I am going to give Angela your phone number, and she'll call you and set up a meeting location. And then she's got the checkbook and everything, and we'll pay you. And thanks for calling us instead of taking them to the auction. I just got off the phone with a horse trader that's planning on taking horses to the auction tonight, and the horses have coggins, so we're able to intercept them, and he's going to sell them to us instead of taking them to the auction where they could be going to slaughter. So it's a big win for intercepting horses, and Keith and Angela are over in Cookeville today intercepting horses. It is really just aggravating in the fact that horses can be taken to auction without a health certificate, without a coggins. Horses can be taken to slaughter without coggins. But if they're coming here, we have to say they have to have coggins. And I know a lot of horses go to auction because of that. That's why we got to change the laws and protect horses. It's when horses are rounded up, say on the reservation, they don't want to send them to slaughter, but the horses have to have coggins if they were to come to us. And logistically, it doesn't work to round up 150 horses, have a vet go in and get them all coggins, wait a week to get that results back, and then be able to transport them when the kill buyer is like, I'll pay you money for them, and he can transport them directly to slaughter. And that is something I think is completely wrong, and there needs to be an exemption made for organizations such as ourselves that have on-site veterinarians as staff, where animals come in and they can get treatment and quarantine and all of that. But tons of horses come to auctions across the United States, all flocking together, no coggins. They might pull coggins there, or they'll have coggins that aren't even matching the horses. So it's just a little something that irritates me. But I'm glad we were able to intercept 5 more. So I got to call Angela and let her know.
So we just got done looking at this big, beautiful boy. Unfortunately, he's about 10 to 11 years old, a stallion, and he has this bilateral lower limb swelling, which is pretty common in these big drafty boys and girls. But unfortunately, because it's so far advanced, the infection is so bad, and his age and how uncooperative he is to be handled. Long-term care with extensive antibiotics and wrapping his legs with compression wraps and all that stuff, it would just be too dangerous for us and for him. So unfortunately, the last act of kindness is the best thing for him at this point.
And he's also a stud, right?
He is a stallion. Yep.
Coming out of the temporary holding pen is another big draft horse. And this one's got a pretty nasty scrape, right? But let's see what the vet team has to say.
Okay, do we not have a mare out at the same time?
Oh, this is Mary?
We could put her back in, we could put her in the stall or in there.
This is a gelding.
That's a gelding. But yeah, we might.
What
Rather
happened?
safe than sorry.
You're like, what is going on around here? Well, we're gonna be getting this great big, somewhat trained stallion out, and it's just best not to sometimes run a stallion right next to another horse when you're trying to get him out. So put that other horse away really quick and you get the stallion out. And unfortunately, with all of his health problems, especially those back legs,
She gave him my.
just sad. Unfortunately, he is going to be given the last act of kindness to relieve his suffering. Now, Dr. Lady says he's between 6 and 8.
Is a gelding. I know.
Suspected that's
Just
her.
hurt. Yeah. Surgical revision.
Kimberly's
He's
trying to save
got
the clipboard.
proud flesh all
Yeah,
around here.
successful.
Let's pull some blood and let's get some radiographs of this leg.
Radiographs are ready.
That's
Wonderful.
A fire hose.
Is the coast clear?
Yeah,
Okay.
I think so.
Right.
Honey,
You're a
already
very
turned out.
handsome boy. He's the perfect size
Be
for
good
me.
folks.
Yeah, he's
I like
great.
it when huge things are bad for folks.
Okay, back into the concreted area. We can get some x-rays on him.
Hi, what a good boy. Oh, you're very respectful. Good boy.
All right, let's see
scared
if
of
we
that?
can
He's
find
a
out
little
how
scared. Are we gonna see
tall
what
this
that
horse is. I don't think the height stick goes high enough, does it?
Maybe. Well, here we go. You can measure based on me.
Whoa.
Is he like
Is-
taller than Oak?
Yeah, he's more than 6 feet at the withers.
Humongous.
You're 6 feet? Let's give him a little bit of subnorm, maybe for reds.
He's impressively tall.
Right? I mean, his withers are taller than my
Yeah,
head,
about-
right?
about-
I'm 5'11".
About 3 inches, so 6'2"ish.
Uh-huh.
I would say almost 19 then.
I like him.
Do you think I could jump on him from the ground?
No.
How old is
don't.
he?
Yes, I think you could,
Yes,
but I don't
yes,
know
I
that
think
you
he's 6 and
should.
8.
I would call him 19 hands.
Yeah, Dr. Lydia's in love.
I know, I love the big ones. I mean, I love all of
Jump
them.
high enough to get this short up there.
I held the high school state high jump record for 10 years after I graduated.
That's really.
I think you could just jump up there. Absolutely.
Can I try?
Oh, sure. Who's holding him?
Jason's my boss.
You need to help him.
Let's ask Dr. Gina. Dr. Gina, should she try based on the, medical condition of this
Since
horse?
Dr. Gina is the only responsible adult present.
I probably wouldn't try until we know what's going on.
And maybe,
The voice of wisdom.
Because if you try and he's got a fracture and he's like, "Wah!" then you know.
You didn't
You
like
just need lead on people.
Do we have fly spray right there?
so Dr. Lydia was wondering if she could jump up on him.
Not without a helmet. That's our policy.
No, so Dr. Gina said not until we know what's going on with the horse. Tani's more concerned about the vet's health. I said she could if she wanted to try.
Got it. I'm sedating him.
Okay.
I'm trying to get this guy x-rayed.
I
He
have SWAT
doesn't like anything
in the
touching
blue
anything
bin.
around that leg, which I can't blame him. It's big and nasty and painful.
Okay, note to everybody, this horse is a lightweight. I only gave him 0.5 of Dorm. How is that?
That is
And also-
very light.
Oh.
Do you want me to swap?
But I mean, like, he's pretty sedated, having had just 0.5 of Dorm for as giant as he
We're
is.
trying to get the x-rays here.
Boy.
He's reacting to horses moving, not you guys.
So Sorry, that was not the best angle.
It's okay, it's not your fault.
I don't know if it's helpful. There
Don't
was
see any
some
fractures.
movement.
Let's keep going.
Okay.
You're a good boy.
Good boy. Move. Before the dog gets done, I'd like to see.
I don't see any fractures. Maybe a splint fracture right there.
Yeah, such a fuzzy little
Right, great. Let's
nose.
keep going.
Custer.
Boy.
Yes, please. Well, osteoid right
Something
there.
there.
Yeah.
What about that? Is that something?
I'm a little concerned about
The backside.
that being a gas tract.
It
He
looks
might
like
have had an initial puncture wound.
It's it's
Right
around
there.
the
Yeah.
posterior.
Do you want to switch to?
Dr. Dina, your plate isn't quite lined up with, can you drop a tiny bit more? Yes, perfect.
Oh, he just moved.
That's okay.
Sorry, I thought he was gonna.
11 a.m.
Did we see anything in the x-rays?
We do see some concerning findings in the radiographs. Nothing that make me want to give up on this guy yet. He looks like he had an initial puncture wound kind of on the lateral aspect, kind of towards the middle of where this large wound is. So that's concerning. And then we have bony remodeling. If it's osteomyelitis, if he has an infected bone in the area, that's going to complicate things significantly. But it was just a puncture wound and the body has walled that off and the infection is in the skin and musculoskeletal layer, then we have a better prognosis. So we're going to run some blood work on this guy. I would love to try the surgery. It's going to be a really complicated, challenging surgery, but the aftercare is going to be hard. So Cleopatra, for example, had her surgical area was about this big, and this guy's surgical area is going to be like this big. So we have a lot more exposed area, and that complicates everything. But I would love to give it a try. He's young, and he's super, super sweet, and I think he's got a shot. So we'll try.
Very cool. Very cool.
I have no issue with him.
And we've got another good size horse coming in here.
You're good. I promise you can fit.
This is the one with the tracheotomy.
Good.
You want some treats? Oh, here you go, Corey. There's treats in here. What a good boy.
You got took the whole hand with it.
Well, clearly he's starving.
Come on, buddy. Can I reach it? I can almost reach it.
Keep on going.
Make it, Hanson, sir.
There you go.
Good boy.
So how much do you weigh, Corey?
It says 1,900 pounds.
Woo! Yeah, the LCDs don't come through my screen very well, but
1894.
1900.
That sounds like a year.
1894?
Yeah,
Wow.
Well, no, 1900.
that's a big horse.
Yep. Give him a drink, he'd be 1900 pounds.
Stress. Horses are obligate nasal breathers. That they put a tracheostomy in him so he could breathe through here. It's definitely infected based on smell and discharge. What's in this horse's favor is that he is breathing through both of his nostrils. So whatever the indication for needing a tracheostomy, he appears to be compensating well. What I'm hopeful of is that if we can get this open, get it clean, and get the infection under control, we can surgically close the trach site. And as long as he's not in respiratory distress, he may be just fine. Like sometimes we put these in from like snake bite to the head or some other transient reason. But if he has fungal pneumonia or, one of many other conditions that might make a horse not be able to breathe adequately through their nose, and we close the trach site, he could decompensate and go into respiratory distress. So he's stable right now, but we are definitely not out of the woods with this guy. He's got a lot of treatment that he needs. We already pulled blood on him, and we're gonna run blood work over our lunch break, so we'll have a better idea how bad that infection is. Yeah, you're such a I haven't seen this kind of trach before.
It looks like a washer from here.
And you know what kind of suture this is, you guys? Looks
Catgut.
like catgut. Sure does.
I've seen a trach tube like that put in, or a trach put in like that for a horse.
Down her neck. Nope. Yes. And back up towards the yes. Ready?
It's gonna be a very interesting extra.
Yeah. Yep, there it is.
Look at that.
Whoa.
So there's a 2-part usually to these guys. There's our vertebrae.
Oh, wow. What's the setting?
So gas is black. Yeah, it was perfect. Gas is black. So here's our trachea. It looks like we've got some, looks like we've
good.
got some scarring there, but I think we can get that out. So it goes in like this, like where one part goes down and the other part fits in and goes up. So to take it out, you turn this one piece and you pull one part out and then you pull the second part out. Should be pretty straightforward if you can figure out which type it is.
Could that be closed up too? Like, or would she always have a hole there in her throat?
It has to be surgically closed.
Okay.
So we'll have to like assess it, clean it. I think we can do it standing. Assess it, clean it, and then you close trachea and all of the layers and then skin.
Do you want to do any head x-rays to see if we can find why they did it?
No, that's okay.
Okay.
You can film this. Yeah. So, hold on, we'll wait. Dr. Lydia, since this is the second horse
Tracheostomy
that's
horse.
come, do you have any recommendations to horse owners about getting it taken care of before they take their horse away from the vet?
Yeah, I think what's hard about these cases is that I have every indication to believe that a veterinarian placed the tracheostomy. I think what often happens is that people try, like this horse would have had to have been in respiratory distress. And so you do that initial triage life-saving thing of placing the trach, but people don't recognize how hard the aftercare is. So most tracheostomy horses stay in the hospital until whatever caused them to need a trach is resolved. And then if people just run out of funds, then they just kind of give up. These get infected very, very easily. It is not a part of the body that should ever be open to the outside. You can see the really thick green purulent discharge coming out of that trach. And obviously her lungs are connected to that. So it's really easy to get aspiration pneumonia and fungal infections and a lot of other things in that part of the body that should be protected from the outside.
So, horse owners, if they have this procedure done, should plan ahead to
Yes.
at least have the veterinarians close it before they leave the vet office.
Well, not necessarily. So there are horses that live permanently with a trach in place, and just like humans with a trach, it is an ongoing medical care. So I wouldn't necessarily say it has to be taken out. What I would say would be if your horse needs an emergency tracheostomy, ask your veterinarian's office for a estimate of what the aftercare looks like and what the cost of that aftercare is going to be, because it's always incredibly discouraging as a clinician to have a horse that you're like, we saved this horse's life, and then people are like, oh wait, there's $4,000 worth of aftercare and this is going to take me 6 months. I didn't sign up for that. And that's communication that can happen on the front end. So knowing what you're getting into can be a huge difference, and it depends on why she needed the tracheostomy to begin with, which we still don't know. There can be, there's a lot of things between the nostrils and the lungs that can cause occlusions, but usually they're kind of up in the head, and they can be, we had a case when I was in vet school where a rattlesnake bit the horse's nose. That case did very well. She seems to be able to breathe out of both of her nostrils fine, because when she came in, that trach had so much gunk that it was fully occluded. But then when we pulled the mucus plug out, she did kind of take a big gasping breath. Although she can't possibly breathe without breathing in and out through that, right? Because it's the most open hole and it's further down her trachea than her nostrils. So I hope she has a chance. Her feet are also, thankfully for Dr. Gina catches things that I miss all the time. She was like, maybe we should take foot radiographs, because if we have, major foot pathology that we're missing, and her feet are absolutely horrific and have been neglected for a really long time. So we're going to take some foot radiographs. But I'm saying she's young. Did anybody look at her teeth? I have no idea how old she is.
So maybe the moral of the story is, if you can't afford hoof care for your horse, don't have a tracheotomy put in.
Or, you know, if your horse is in respiratory distress and there's Horse Plus could take this horse, place a tracheostomy, and continue appropriate aftercare. So it's not like there are no options, but know what you're committing to on the front end. And if you're ever in a position where you have a horse and you know it has medical needs and you can't provide for those needs, look where you are. A lot of veterinary teaching hospitals will take cases if the owner will surrender them for ongoing care. So I hate that whoever had this animal felt like the only option for her was to dump her in the slaughter pipeline. And she's giant, and she's one of the only horses that came in today that's at a great body condition score. So unfortunately, she's the kind of horse that whose kill buyers are looking for. She's a very good girl.
As if we haven't been busy enough, we have another trailer and truck showing up. This is great. We're gonna have to stop for lunch here pretty soon, but we do have another truck and trailer pulling up right now, and we're gonna get the absolutely critical ones done, take a quick lunch, and we're gonna be right back at it. So let's see who comes off the trailer. We never know. Alrighty, so I overheard the guy saying that the horses are all gentle and you can lead them right off. So let's see, hopefully there's some really healthy ones in here. Seems it has some back left leg pain.
Yes.
All right, here they come. So we've got on 3, 4. Number 5, number 6. That one looks to me, and I could be completely wrong, the one in the back kind of looked like it's maybe blind, but maybe not. Just kind of holding its head a little interesting. So beautiful horses. All right, well, hi guys. These are the horses just came off the trailer. 2, 4, 5, 6, and 7. It looks like. Just take some time to get to meet them. It's like Dr. Lydia is starting on that one already. Take a look at it. And she says he's a gelding. Let me get over there and show you closer what's going on.
Subluxation at 44, like having just come off the trailer to me is like basically normal. So I don't know if you want to, do you feel safe turning this horse? I don't think this horse is actually painful. I think that right hind leg might be unstable, but.
You want him like all the way turned? Or
Just a few steps that way.
It said he is incredibly broke to ride too.
So what they said is that he bought it for not that Corey was saying. You were starting to, and I jumped in.
So what did he say?
He said that he bought the horse and he was going to keep it, and it was a horse for his wife, and then he went dead lame. So it's very possible he could have picked him up from an auction, and he was drugged, so he wasn't appearing to be lame. There's a whole host of things that happen to horses within the slaughter pipeline, which are terrible, but hopefully we can fix him. He's the best chance here.
he gated. Looks like a quarter horse.
This is totally a quarter horse.
Totally a nice quarter horse.
Exactly, hippie.
He said he was skinnier than that one.
Maybe
That's whatever it was.
you have normal everywhere, just your hind leg. So this horse is a great example of sometimes they look like they're crippled lame. This horse is very abnormal, but he's not acutely painful. He has evidence of maybe a spinal injury. Dr. Gina and I are going to have to do a more thorough neurologic exam. So he's probably 22. You're a very good boy.
So what did you notice, Dr. Lydia, whenever...
Corey told us we had to break for lunch, so he is lead rescuer, so he's in charge. And we're gonna break for lunch, and we're gonna be right back after the humans have their food, and Dr. Lydia is making sure the horses have their food. How nice of her. That's just awesome. Just awesome. Well, we've probably got some stuff in our teeth, so bear with us. We just got back from lunch. We're ready to get rolling again. We have more trailers on their way. We got horses to intake. It's a busy, busy day, and I've got to go edit this video soon. Well, we're gonna get some more horses intaked, and then I'm gonna go edit this video and get it out for you. Sorry. Alrighty, Corey's bringing in a horse, and this is the first one after lunch. A little gated mare, they said. Kind of droopy eyes, but nothing too bad.
And she does have some udder development, so we're going to check that out.
16.
I got it. Is his tail tendon cut? It looks cut.
I thought if they were cut, they lay like straight over.
Maybe it's just very loose.
I would still call this a Tennessee Walker.
Want a preg check
I mean,
her?
we're gonna have to do intake stuff tomorrow anyway.
Yeah.
With new horses coming, so you might as well do it now.
Yeah, let's see.
I am not opposed.
Okay, sounds good.
See if she's pregnant. It's very interesting.
Anything? Maybe I can balance this here. I'm probably gonna need you to hand me the lube several times. Hey, girl.
Dr. Lydia is doing the preg check. And
Swoop it out. The rib cage. Feels like it's in the right. It's like right at my fingertips.
Why we need a better ultrasound?
I think that's baby right there. One of my amazing mentors donated a ton of equipment for us and cut us an amazing deal and stuff. But this ultrasound is quite aged. Thank you, Dr. V. And so our ability to see depth and clarity is pretty limited. So my accuracy is based on what I can feel in my best guess. But.
so what'd you find in there?
So I'm not 100% positive, but I do palpate positive indicators of pregnancy in this mare. She has a lot of uterine tone and she has fluid in the body of her uterus. So I wasn't able to see baby heartbeat, but I can palpate what feels like a rib cage. So there's nothing else in the caudal abdomen of a horse that feels like a rib cage. This mare is old to be a mom, but she has mammary development and I was able to express milk. And I don't see any activity on either of her ovaries. So we are going to take a close look at her. She needs her teeth done really, really badly. And I'll probably follow up with some blood work on her to see if we can stage, confirm and stage gestation.
I'd send you pictures of this horse, Kimberly.
Extra year.
Dr. Gina is preg checking this mare. And yeah, she's trying to figure it out. Now Dr. Gina, who's way over there, is doing an ultrasound.
Why don't you try? Get further up. GI. Some good paracelsus. Maybe.
Yeah.
From sweeping right to left.
It looks like you should be past pelvic brim.
And that's what an ultrasound looks like with our machine.
So inconclusive. Maybe not.
In the golden morning light, I saw him standing there. A beautiful horse with wounds and scars, but a spirit so rare. His eyes like diamonds, reflecting a soul unbroken. I knew in that moment this horse had a story yet to be spoken. From the moment we met, I felt a deep connection, a bond so strong, born out of love and protection. Gentle hands we tended to his every need, slowly healing his wounds, planting hope like a seed. Oh, rescued heart will give you a brand new start. In your eyes, a million stories unfold. With every beat of your strong, steady hoof will nurture your spirit, watch you soar aloof, aloof.
Hey, we didn't assign this guy a number, right? Okay. You can see the height difference between the wings of the pelvis. So this guy has a very abnormal left hind leg, and if you look at his pelvis, you can see how prominent this hip bone is, and it's much higher than this one. And then if you look at the musculature from behind, you can see severe atrophy on this side, so this leg isn't being used, and hypertrophy on this side. And if you look at the way the horse is leaning, he's actually leaning almost all of his weight onto this right hind limb, and when he walks, he's avoiding use of that limb at all. So the appearance of this hip bone looks like a possible pelvic fracture. I'm gonna try to get some images. The pelvis is really hard to image, but if the fracture is right up here, we might be able to catch it. But unfortunately, we don't have a lot of tools for fixing a pelvic fracture, so we'll see what we find.
Deep connection, a bond so strong, born out of love and protection. Gentle hands we tended to his every need, slowly healing his wounds, planting hope like a seed. Oh, rescued heart will give you a brand new start. In your eyes, a million stories unfold. Every beat of your strong, steady move.
Where's your tail?
Your spirit,
Where's your tail?
watch you soar aloof.
Yeah, we hold his tail over to one side.
Hi, friend.
His upper incisors are worn to the level of the gums, completely on that side. Got a little bit of a occlusal surface on this side.
When you're done putting the horse back, you can hang it off.
The pelvis.
All you can do is try.
That's right.
Like, this is how you
Check.
do it. I mean, did he get this? I'm not sure. Good question. Did you say we're doing the white one next? Yes.
Well, we got the wing of the ilium.
Yay!
Pretty clearly. No, unfortunately, we have no answers. The pelvis is really hard, right? Because in order to get the pelvis, we need to shoot through, like we would hold the plate here and shoot through here. How do you feel about us touching up here? Let's try. That doesn't feel totally normal. Let's try putting the plate. He is not sedated. He's been a very good boy, but Caitlin, keep a really close eye on his ears for us. Is that as high up as we can get it?
Yeah, that is. Sorry, buddy.
Good boy.
But the microchip is in.
Let's take. Yeah, I just think it's proximal to this. This is patella. This is pretty typical of what we get when we have suspected pelvic injuries. The pelvis is a really weird set of bones that's kind of like a box, and our ability to image it is pretty limited. Some, like a university, might have a big enough X-ray equipment that they can shoot through it, but what I suspect in his case is that he has an injury in his pelvis at some point between the ilium and the ischium. So that this is ilium and this is ischium, and we don't have the ability to, his body comes down here, so we can only get our radiograph plate up this high, so we can't really if we try to shoot through here, we'll just get a bunch of fuzz, which we could try. But unfortunately, in this horse's case, I think he is unstable. I think he's quite stoic. But the severity of this lameness and the fact that he's overloading almost completely onto that right hind leg make me worry that he's not going to improve and that he's at a good chance of having failure of that support limb.
We're gonna try one more angle, see if we can't see anything. That's a long ways for the X-ray to go through.
Yeah. Yeah, so we just got fuzz. We got a tiny little bit of the edge of a bone.
Yep, our X-ray just isn't powerful enough, which, I mean, it's a handheld X-ray, so we wouldn't
Honestly,
expect
this one's
perfection.
pretty great. The biggest anatomy I've been successful shooting is an elephant stifle, which is smaller than an equine pelvis, so yeah.
So inconclusive on this horse so far, but I have absolutely got to get down and get this video edited for you guys. Sorry I wasn't able to stay for all the horses. There's still horses being picked up hours and hours away from here. There's trailers on their way. It's going to be going for all of today, tomorrow, but this is a big rescue. We've saved a lot of horses so far, and there's more on their way. So thank you guys so much for watching. Watch full Horse Shelter Heroes to see all of the horses and meet them all, and just watch the whole intake process. So thank you guys so much for your support. And if you can, please donate.